My name is Kaylee. I'm an admin for Natural Chaos. Thank you for watching my video first off. So today we're going to be discussing buttock augmentation, specifically with filler, and we're going to touch base on buttock augmentation using threads. So both of these items have been brought up in the group recently, and we just wanted to create a video to discuss a little bit more information about these procedures and talk about different safety concerns involved with these procedures as well. So just some housekeeping before we begin. So what I'm about to review and discuss is not to be construed as medical advice. It is for entertainment purposes only, and I also do not endorse, support, or promote any procedure or treatment that is performed with non-FDA approved products and or by any individual not credentialed or licensed to do so. And just keep in mind that practicing medicine without a license is illegal. Just some housekeeping, wanted to put it on the table. Now that that's over, we can talk about the fun stuff. So buttock augmentation using injections is obviously injecting the buttock or the area around the buttock using some kind of volumizing substance to either add volume, create lift, or fill in some kind of void. For an example would be like a cellulite dimple or a hip dip. So some substances used for this could be silicone, hyaluronic acid, calcium hydroxyapatite or radiase, or polyl-lactic acid, which is PLLA, the active ingredient in Sculptra. PLLA, we've seen that in some threads. It's the same chemical. So Sculptra and radiase, how they work, they're biostimulating fillers. So it creates basically an inflammatory response. And your body then at that point, collagen synthesis occurs. So your body is reacting by creating collagen. So you have the filler working for you as well as your own body working for you, leaving collagen behind. So biostimulating fillers are really cool options. One of the reasons why somebody might seek out a buttock augmentation using a filler is that it is significantly cheaper than having a buttock augmentation with traditional implants. Traditional implants are similar to breast implants and can be silicone. I believe they have saline as well. But they are expensive, and fillers can be significantly cheaper. But one of the things to keep in mind is that the initial cheaper upfront cost may come back and bite you. There are significant complications and dangers associated with filling the buttock and the buttock area. So what may be a smaller fee at first can come back at a much higher cost in complications, follow-ups, revisions later on. So just a little bit more about buttock augmentation with filler. It is actually technically illegal in the United States. This does not mean that, you know, the police are going to show up banging on the plastic surgeon's door and hauling him off to jail. What it means is that there is no FDA approved product intended for injection to the buttock for volumization. This is an example of an off-label use. So what that means is that the medication is not being used in the way that it is intended to be used. The FDA has a very rigorous screening process to determine if a medication is safe before it goes out on the market, and something that does not have FDA approval or is not used in the intended way per the FDA, it is considered an off-label use. All right, so if you're thinking of having this procedure done and you find a plastic surgeon or provider who is willing to provide this service, you want to have a discussion with them. You want to ask them where they were trained, how many of these procedures they've performed, if they're familiar and knowledgeable in dealing with complications that can arise from this procedure. These are all things you want to discuss with the provider before the treatment has been done. If the provider can't give you answers or isn't comfortable answering your questions, I would definitely, get a second opinion. You're paying them decent money to have a procedure performed. They should be more than willing to be able to answer your questions. You want to know who trained them, where they went to school, what products are they using, how much are they using, how they're prepared to react in case you have an allergic reaction, if there's some kind of vascular occlusion. You want to know that they have this knowledge in their tool belt basically and are ready to respond if needed in an emergency manner. Some other consequences to this would be infection. Infection's always a potential. You always want to keep that in mind. Disfigurement, scarring, allergic reaction, stroke, or death. Those are just some examples. There's a myriad of risks, but those are just some major ones you want to keep in mind. If a practitioner is not experienced with performing this procedure, they could accidentally inject some of the filler into a vessel, which could lead to occlusion and necrosis to an area, or serious injury to yourself, resulting in potentially death. So it's really, you want to keep that in mind. So I just wanted to discuss some different alternatives to buttock augmentation with filler, one being a fat transfer. A fat transfer is not appropriate if you don't have the available fat to transfer, which may be why somebody would want to receive filler in their butt. So what happens with a fat transfer? Fat's removed typically from the abdomen or lower back, bra strap area, wherever there's excess fat that you would like thinned out. That fat is then placed in or around the buttock to provide a lifted appearance or a larger appearance depending on what your desired look is. The Brazilian butt lift can also be used in conjunction with silicone buttock implants, again depending on what your desired look is. Silicone implants are a more traditional route. There is more downtime, and you really want to make sure you find a surgeon who is very comfortable doing this. With silicone implants, you have the risk for scarring, encapsulation of the area similar to a breast implant, implant rejection. There are another full list of dangers associated with implants to the buttock, so just keep that in mind as well. Another really cool option is the padded underwear that's out there. If you just want a little bit more curve for an event, they have, they're basically Spanx that have some pillows built into them, but it does give the rear end a nice rounded appearance. So just keep that in mind. That obviously is temporary. As soon as you take them off, it's gone. And they're pretty cheap. You can find them on Amazon. So, and they're washable. Cool, huh? One of the dangers with filler to the buttock would be if a filler needs to be removed. Removal can be potentially dangerous depending on what is injected and if it was done legitimately or if a non-legitimate product was used. If you are having issues after receiving, a cheap buttock augmentation and you go see a plastic surgeon, you want to be honest with them, let them know what you know about the injections, because the more you tell them, the more prepared they'll be for removal. But obviously removal can lead to product migration to different areas. It can lead to disfigurement and scarring because you're going to be removing that product. There's going to be, some kind of volume loss to that area, obviously. We'll just touch base quickly on buttock augmentation utilizing threads. So threads have been something that we've been seeing more and more in the past couple months. What threads are special sutures that are used to lift the buttock area. And this has a goal to give a more rounded appearance to the area. And then when you have a rounded lifted butt, it can be it is a more youthful look. So threads are inserted typically with a cannula or straight needle. Risks obviously would be infection, uneven placement. You could have dimpling with tissue pulling. The threads, so PDO threads are approved by the FDA. They've been approved by the FDA, and this is a material that has been used for years as dissolvable sutures. So it has a proven track record. It is a safe material. So how it works, it promotes collagen synthesis. So your body responds and produces collagen. So as the threads dissolve, which typically it takes about 6 months for the threads to dissolve, they'll leave behind the new collagen. So that is buttock augmentation using filler, and I touched lightly on buttock augmentation with threads just a little bit. I just wanted to kind of give you a quick run through about the procedure itself and the different safety concerns associated with it. You know, I hope you learned something from the video, and I hope you keep these things in mind if it is something that you're looking to proceed with. So thank you for watching, and hope to see you guys soon. Bye.